the motion to renew the Coronavirus Act. When we first introduced the Act back in March, I said that coronavirus is the most serious public health emergency that the world has faced in a century. And now, 6 months later, it is still the most serious public health emergency that the world has faced in a century. And since then, we've worked hard, overwhelmingly across party lines, and sometimes at great pace, and come together to slow the spread of this virus. And with the help of this Act, we protected the NHS, we built the Nightingale hospitals, we welcomed thousands of clinicians back to the front line. This Act helped get people more appropriate care faster, helped the NHS and social care harness technology like never before, and has allowed the government to deliver unprecedented economic support in troubled times. And while we've made huge strides in expanding testing and huge progress towards a vaccine, with the virus still at large, so this Coronavirus Act and the measures within it remain as important as then. Our strategy is to suppress the virus while protecting the economy, education, and the NHS until a vaccine makes us safe. And this Act is still needed to keep people safe. Now, I understand, Mr. Speaker, these are extraordinary measures, but they remain temporary, time-limited, and proportionate to the threat that we face. Some of the measures we seek not to renew. Some have, thankfully, not been used, but it's imperative that we maintain the ability to use them if needed. And some of these measures have proved critical to our response and are now used to keep people safe every day. So to stand down this Act now would leave Britain exposed at a time when we need to be at our strongest. And Mr. Speaker, this virus moves quickly. And so we need to have the powers at our disposal to respond quickly. And it is deeply important to me that we strike the right balance between acting at pace and proper scrutiny. I believe in the sovereignty of Parliament. And I believe that scrutinised decisions are better decisions. And I believe in the wisdom of this House as the cockpit of the nation. Now, this has been an unprecedented time. This House has had to do many unprecedented things, many of which have been uncomfortable. I've listened to the concerns raised about the scrutiny. And as you pointed out earlier, Mr. Speaker, there have been times when this pandemic has challenged us all, and we have not been able to do this as well as we would have liked. I therefore propose that we change the approach to bringing in urgent measures, and I'm very grateful to all colleagues who we've worked with to come forward with a proposal that will allow us to make decisions and implement them fast, yet also ensure that they are scrutinised properly. Today, I can confirm to the House that for significant national measures, with effect in the whole of England or UK-wide, we will consult Parliament. Wherever possible, we will hold votes before such regulations come into force. But of course, responding to the virus means that the government must act with speed when required, and we cannot hold up urgent regulations which are needed to control the virus and save lives. I am sure that no member of this House would want to limit the government's ability to take emergency action in the national interest as we did in March, and we'll continue to involve the House in scrutinising our decisions in the way my right honourable friend, the Prime Minister, set out last week, with regular statements and debates, and the ability for members to question the government's scientific advisers more regularly, gain access to data about their constituencies, and join daily calls with my right honourable friend, the Paymaster General. And I hope these new arrangements will be welcomed on all sides of the House, and I will continue to listen to colleagues' concerns as I've tried my best to do so throughout. And I'll give way.
I'm grateful to my right honourable friend for giving way. Can I also thank him for being prepared to listen and for the constructive conversations that we've had over the last couple of weeks. As he said, members on both sides of the House understand the importance of ministers having the freedom to act quickly when it's necessary, but we are grateful that he and other members of the government have understood the importance of proper scrutiny in this place and the benefits that that can bring to better government as well.
Well, thank you, Mr. Speaker, and I'm grateful to my right honourable friend, and I agree with him about the point about scrutiny. And I'm very glad that we've been able to find a way to ensure that we can have that scrutiny and colleagues on all sides can have the opportunity to vote on, and we do so in a way, though, that still doesn't fetter the government's need to act fast to keep people safe from this virus. So, of course, I'll give way.
Speaker, I'm extremely grateful to my right honourable friend for what he's set out and the manner in which he's done it, and I thank him very much indeed. He said earlier that some of these provisions he wouldn't be renewing. Could I just invite him to say something about mental health and also something about Schedule 21 relating to potentially infectious persons?
Well, thank you very much, Mr. Speaker, and I'm grateful to my honourable friend. We've been working together to try to find a way through this that works both for the House and for the circumstances. On Section 21, there has been a change in the way that this section is used, and I believe that has reduced some of the concerns in this area, but we'll continue to keep it under review. When it comes to mental health, I will say something on that later in my statement, because there are measures on mental health that we put forward in the Coronavirus Act that have not been used and that we are not seeking to renew. And I hope that that will reassure colleagues that we take a proportionate approach to these measures and that we want to make sure that we have the measures that we need, but where we don't need the measures, then we will set them aside. And I'll give way to the member from the DUP.
The Secretary for that and for all that he's done as well. And I've spoken to him many, many times about these things. I'm sure the Secretary of State, is like myself, has been receiving lots of emails, all of the outlined the concern to strip back health and social care. And I believe a government must ensure these powers can only be used as absolutely necessary and not to save funding whilst leaving people without appropriate care. So can I ask the Secretary of State, please, for an assurance as to how the regulation of this power will take place and people's rights for health and social care will be protected?
Yes, the powers in the Coronavirus Act have allowed us both to ensure that people get the care that they need and that that care is, where necessary, targeted, but also allow people to get better and faster access to care when they're in hospital and having to leave and ensure that there's a care package there. And the measures on care in this Act, in their totality, have without doubt helped us in being able to both protect the NHS and support social care, and crucially to support the patients who need that care, and therefore, of course, we'll be taking them forward because of that positive overall effect. I'll give way to the leader of the Liberal Democrats and then to my colleague.
I'm grateful for the Secretary of State giving way. Has he seen the evidence that many disabled people and people needing care have not received the care they need, and that if he listens to those organisations representing disabled people, they're extremely worried about particularly Schedule 12 and the easements on the duties of local authorities to assess and meet care needs? Is he telling the House that the government is not renewing this section? Yes or no?
Yes, we are renewing this section because it's very important for ensuring that we prioritise care for those who need it most. I know that the concerns that he raised now were raised during the passage of this Act. In fact, we had a good discussion on it then, and I believe that the way that this Act has worked has overall improved access to care for people, both in terms of in hospital and in our social care system, which of course has been an area of great scrutiny throughout the pandemic. And I'll give way to the former Public Health Minister.
Indeed. I thank him very much for his sensible, I think the government's sensible measures today on the involvement of this House and the ongoing consent of this House, because there is widespread public concern out there around consent and the measures that we are imposing on their lives. But just to be clear for the public watching this debate and from some sections of the media watching this debate, many of the restrictions that we are hafting reluctantly to place on our constituents' lives do not come through the Coronavirus Act 2020. They come through many other pieces of legislation, primarily the Public Health Act of, I believe, 1984.
Yes, what I've said relates to measures to do with the pandemic response. As he says, the vast majority, in fact, of the measures in terms of social distancing restrictions are under the Public Health Act 1984. Only a minority are under the Coronavirus Act. Nevertheless, the point about scrutiny is an important one, no matter what the origin of the statutory instrument. What we've managed to do is essentially innovate parliamentary procedure to find a way that we can move both quickly and also with the proper scrutiny of Parliament. And that's what we've been seeking to do. You know, this is in these unprecedented circumstances, many innovations have had to be made, not least in Parliament, and this is another one where there were two contrasting needs, the need for proper scrutiny and the need for very speedy action. And I'm really pleased that we've been able to find a way through that I hope commands the support of the whole House. I'll give way to the former Chief Whip.
Very grateful to my right honourable friend, and can I thank him and the business managers for the work they've done in reaching this solution. And I hope, Mr. Speaker, that you will think that following your stern words earlier, the government has listened and come forward with some measures which have responded appropriately. Can I just press the Secretary of State? He said in his remarks that the government will bring forward votes in advance of the measures coming into force on national measures covering the whole of England or the whole of the UK. Obviously, some of the measures that have come into force so far have been quite significant, covering large parts of the country and millions of people. Now, I accept there's a judgment to be made here. Could he say a little more about where that line will be drawn, about what's brought to this House in advance?
In a way, my right honourable friend, who has huge experience in these things, answers his own question, because, of course, there's a judgment to be made. We've made a very clear commitment to the process that we will follow, and I hope that over the weeks to come, we will demonstrate through our actions and through what we bring forward that we are true to this commitment, which essentially will become a new convention. If I give way to the honourable gentleman from Leeds.
Health Secretary, for giving way. Given the number of cases in which Schedule 21 has been inappropriately used, could he explain to the House what the definition is of a potentially infectious person? How is a police officer meant to know who is potentially infectious? And in the middle of a pandemic, does that not include every single one of us? And aren't the powers that the police have then been given to detain us really quite worrying? And will he undertake to look at this again?
The right honourable gentleman will know that this has been looked at again in terms of the guidance, and the CPS have issued new guidance which has rectified the concerns that were raised at the start, and I am satisfied that that new guidance is appropriate and proportionate, and therefore I am satisfied that we should renew Section 21, because to answer his point, it is crucial that in circumstances where it is necessary to act to keep people safe, then we have the powers to do so, but they must be proportionate. I think that the guidance has answered that. And now, Mr. Speaker, if I may, I'll just make a bit of progress, because otherwise I'll take the whole 90 minutes myself, if that's okay. The central point is that we need to make sure we balance this, we get the scrutiny right, and we have the need to act fast. And, Mr. Speaker, the vote tonight is a vote about whether to renew the Coronavirus Act, and I emphatically would urge members on all sides to vote in favour of that act, because of the broad range of powers without which it would simply be impossible to have an effective response to this virus. First, the Act has helped us to boost the health and social care workforce. One of the achievements in this crisis is that we're able to protect the NHS. And one of the reasons we were able to do that is because we were able to support people on the front line. This Act allowed the emergency registration of health and social care professionals, nurses, midwives, paramedics, social workers who wanted to return to the national effort. And skilled and experienced staff were able to return to work and add capacity at a time of emergency. Second, Second, this Act does not just support the NHS front line. The second part of the Act protects all public servants who keep the UK running safely and securely. Over the past few months, we've seen huge changes in the way our public services have operated. This Act allows for remote working, it allows for moving meetings online, and it's about acting quickly to prioritise essential activities. The Act supports vital, temporary measures that have allowed public services to keep their work going. This, for instance, includes courts keeping it running in a COVID-secure way through the use of virtual hearings. Up to 65% of hearings each day now involve somebody joining remotely. So it is integral to maintaining the rule of law that we keep these measures in place. The measures have also kept local democracy going through allowing councils to hold their meetings virtually. These are sensible and pragmatic steps that have helped us keep vital institutions operating in the midst of the pandemic. The Act gives the Home Secretary powers to close and suspend operations at UK ports and airports if there are insufficient staff to maintain border security. Now, this is one of the powers that has not yet been used, and I hope we will never have to use it, but it remains an important tool at our disposal. I'll certainly give way.
And I welcome the statement that he made earlier on. My constituents are incredibly concerned about the powers that are given within this Act. And I would argue that it's not only about scrutiny, allowing this House to debate and vote. It's also about giving my honourable member, the Minister, the credibility to continue to do the work that he's doing. It also exposes the very difficult decisions and trade-offs he has to make when he's balancing the spread of this virus versus all the restrictions we have to undertake. So I welcome the opportunity for further debates, much longer, I hope, and votes too.
We are absolutely open to further and longer debates, as, for instance, we had the debate on Monday. By the standing orders of the House, this debate is 90 minutes, and neither the Speaker nor we had the choice over that. But we did introduce a full day's debate on Monday, and there will be many more debates to come. Now, Mr. Speaker, I also want to come to a measure that we will not be renewing, because I've said that we will only keep measures in place for as long as necessary. And I can tell the House that there is one area where we will revoke a power that was part of the original Act. When creating the Act, we included provisions to modify mental health legislation to reduce from 2 to 1 the number of doctors' opinions needed to detain someone under the Mental Health Act, and to extend legal time limits to the detention of mental health patients. These were always powers of last resort, and I was not persuaded, even in the peak, that they were necessary, because our mental health services have shown incredible resilience and ingenuity. So I've decided that these powers are no longer required in England and will not remain part of the Act, and will bring forward shortly the necessary secondary legislation to sunset these provisions. Mr. Speaker, the third part of the Act contains measures to suppress the virus. And as a nation, we've of course succeeded in suppressing this virus once, thanks to so many sacrifices by so many people. But with the cases on the rise, we know that there is more that needs to be done, and we need to do it together. Our central strategy of suppressing the virus while protecting the economy and education and the NHS until a vaccine arrives is underpinned by this part of the Act. It gives us stronger powers to restrict or prohibit events and public gatherings, and where necessary to shut down premises. It gives police and immigration officers the power to isolate a person who is or may be infectious. And it allows us to close educational settings or childcare providers. Again, these are not measures anyone wants to use, but we must keep them in place for the moment, because we need every weapon in our arsenal to fight this virus, and these are a proportionate response. I'll give way, and then to the honourable gentleman.
With me, therefore, Secretary of State, that this virus clearly behaves according to how each and every one of us behaves. And will you join me in condemning what we saw on the news this morning at Coventry University, where some students were behaving in a shameful way, up close and personal, partying?
A little bit. The Secretary of State did say the time could have been extended. Yes, it could, and I would have agreed to it. Secretary of State.
Thank you, Mr. Speaker. The comments that my honourable friend makes are absolutely right. The need for all of us all of us, to exercise responsibility in a world where a virus can pass asymptomatically without anybody knowing that they have it, is sadly a feature of life during this pandemic that I hope will be over sooner rather than later. And so I agree with my honourable friend, and I give way over here.
I'm very grateful for the correspondence that he and I have had over a specific issue which relates to local restrictions in Wales, which have been imposed quite rightly, I think, by the Welsh Government, which mean that people aren't allowed to travel outside their county borough area except for a reasonable excuse, and that does not include going on a holiday. This means that lots of people have lost every single penny of their holiday because lots of companies have refused to pay out on insurance, have refused to change the date of their holidays. They say that Welsh Government rules are just guidance and don't have the full force of law. I hope he can stand at the dispatch box now and say very clearly to those companies they should be reimbursing people because this has the full force of law.
Of course, the companies involved should be making recompense where that is appropriate, and I hope that we're able to come forward with a resolution to this issue sooner rather than later, because of course the Welsh Government is the legitimate body that makes the rules in terms of the local measures in place in Wales. And that is the devolution settlement, as we've discussed many, many times in the last 6 months, and people should respect that. Mr. Speaker, if I just make some progress, the fourth part of the Act contains measures for managing the deceased. And this is a devastating virus that has caused pain and suffering for many, and that tragically has taken away many loved ones before their time. And we've worked hard to treat them with the utmost dignity, along with protecting public health and respecting the wishes of the families of the bereaved. And the Act expands the list of people who can register a death to include funeral directors, and sets out that coroners only have to be notified when there is not a medical professional available to sign a death certificate. It allows death certificates to be emailed instead of physically presented, removes the need for confirmatory medical certificates in order for a cremation to take place, and relieves coroners from the need to hold inquests with a jury in suspected COVID-19 deaths. And over the past few months, these powers have eased pressure on coroners, reduced distress to the bereaved, and allowed funerals to take place without delay, and we therefore propose to keep them. Finally, Mr. Speaker, the fifth part of the Act includes measures to protect and support people through this crisis. The financial support provided by this government has proved to be a lifeline for so many, and these measures in the Coronavirus Act made this support possible. The Act provides for the furlough scheme, the temporary increase in working tax credits, and making statutory sick pay payable from day one. Without the Act, we wouldn't have furlough and we wouldn't have the job support scheme. And the Act also includes measures to protect both business and residential tenants by delaying when landlords can progress evictions. So I know the burdens that this virus has placed on the livelihoods of so many, and we've worked to give as much protection as possible. And I think that the whole House will want to keep these powers in place so we can continue to help people in future. And without the passage of this motion today, Mr. Speaker, the financial support for people that is provided for and legally underpinned in this Act would not be legally possible. So I understand that many colleagues may have concerns about individual parts of the Act. But a vote for this Act allows many of the necessary legal powers that have been required, including underpinning the financial support that has kept so many people afloat during the crisis. And I'll give way once or twice more, and then I'll conclude.
I'm very grateful to the Secretary of State for giving way. Will he agree, though, that the inconsistent and sometimes nonsensical application of some of these rules is doing damage to some of the businesses that he talks about? I'm thinking in particular of the wedding industry and the many families who have been affected by that. The rule of 6 surely can apply so that a place that can take many multiples of 6 could host weddings and give people their special day and not kill a vital industry, not just in the lakes and the dales, but across the country.
I think we've shown, Mr. Speaker, throughout that we're always willing to try to improve these, the way that the rules operate in a way that is safe. And of course, at weddings, people do tend to to physically come together. It's a time of celebration of love, and that's in its nature. And so we make restrictions with huge regret, but we always keep an open mind as to the public health evidence. I'll give way one more time here, and then up there, and then I'll conclude.
I thank the Minister for giving way. Just very quickly on that last point, if the Coronavirus Act was voted down today, will the Minister not have 21 days to bring forward to this House another act that the House can then agree?
Yeah. Mr. Speaker, the principle of the Coronavirus Act is that it underpins so many of the actions that are necessary, and to remove, to vote down the Act and not to renew it would lead to an undermining of the actions that we need to take in order to keep this country safe. I'll give way to my right honourable friend.
I'm most grateful to the Secretary of State for giving way. I have a lot of sympathy with what he's saying, but can I also support what was said by the honourable gentleman for, I think it's Westmoreland over there, about not only the wedding industry, but also the exhibition and events industry? Will he at least bear in mind that good sense from careful people who are seeking to be COVID sensible and compliant would enable him to exercise some flexibility in the very inflexible rules that currently govern those two very important industries which are flat on their backs?
We're always happy to look at the evidence of how these things can be done, absolutely, and I'd be very happy to talk to my right honourable friend about how we could take this forward. I'll give away one final time.
I'm very grateful to my right honourable friend. Just on that point, on the wedding industry and the limitation of 15 people at any of those venues, I think it would help a lot of them in that industry, which is struggling desperately, to see the evidence, both the public health evidence and anything else that has been judged to be played into consideration for coming to that judgment, because it does stand out between them and the rest of the hospitality industry, and now for the next 6 months they're going to be in a further desperate state.
Yeah. Well, I will ask my right honourable friend, the Business Secretary, to take up the point. I think the Business Department is the department responsible for it's the department responsible for making sure that the business rules are right, and I know that they look very carefully at them. Mr. Speaker, this Coronavirus Act, remains just as fundamental as it was when introduced to the House 6 months ago. We will beat the pandemic, but we're not there yet, and therefore I urge the House to approve this motion so we can keep responding with speed and with strength. And as we have heard during this opening of the debate, we are always looking to listen, to learn, to improve the response as much as possible. But without this act, our response will be very significantly harmed. And at a time when this nation is being tested like never before in peacetime, I commend the motion to the House.
The question is motion number 5, as on the order paper. I'm going to call the Shadow Secretary in a moment, just to remind backbenchers, 3 minutes, please, for all backbenchers, not front benchers. So I now call Shadow Secretary Nick Thomas-Simmons. Nick Thomas.
Thank you, Mr. Speaker, and I'm grateful for the opportunity to speak in this debate, having taken the bill through its committee stages back in March. We come to the House today to debate the renewal of the provisions of the Coronavirus Act in the gravest of circumstances. Here in the United Kingdom, we've seen over 42,000 deaths, lives altered in ways unimaginable a year ago, and our economy facing one of the worst recessions on record. Now, we do accept the challenge that presents, and it's why we've recognised that the government in a pandemic, any government, needs extraordinary powers available, and why with a heavy heart today, and facing this highly unsatisfactory situation of an all-or-nothing motion, we will not be blocking its passage today. We have supported the government when it's right to do so, and the British people who've sacrificed so much in the national effort to address this virus deserve nothing less. But today, we say to the government that things cannot go on as they are. The incredible efforts of the British people have not been matched with competence and grip by the UK government. Announcements about measures made overnight with no proper notice and no proper power of review. Government ministers on national media with absolutely no idea of what the rules are. The public are being let down on a grand scale. The government has had virtually all the resources and brilliance of our remarkable country on demand for over 6 months. They've been able to call on the UK's remarkable frontline workers who've shown incredible skill and bravery through this crisis. And yet we've ended up with one of the highest death rates in the world and on the threshold of one of the deepest recessions. At the same time, the road ahead is anything but clear. Our testing system is inadequate at the very moment we need it most, and this is having a devastating impact. Losing control of testing means losing control of the virus, and it's that loss of control which makes further restrictions necessary. And it's restrictions that are having a devastating effect on families and businesses up and down the country. This dire situation was not inevitable. It is the result of a chronic failure of government. And today we must take stock of where we are and the urgent need of the government to get a grip. I'll give way to my
Honourable friend also agree that the government's attempting to shift blame onto local councils, who quite rightly are wanting restrictions. But what's happening is they're asking for things and not being given them, and then there's no consultation at all on how they should be implemented locally, which is leaving them with the confusion we've had over the last few years. Secretary of State shakes his head, but in the North East, that is exactly what has happened. Does he agree with me that if councils do ask for things, what should happen? It should be a joint approach rather than just a diktat from Whitehall.
My right honourable friend is absolutely right, and part of the need for the government, the UK government, to get a grip is to work with the other governments and local councils around the United Kingdom on an equal basis. Now, right at the start of the pandemic, Mr. Speaker, the World Health Organization said test, test, test. And it was clear that that would be a vital element to regaining any form of normality. The government had the country's full resources on hand, and on the 20th of May, the Prime Minister promised a world-beating test, track and isolate system by 1st of June. Now, I'm not asking for a world-beating system. An effective one would do just fine. But shamefully, this has not been achieved all these months later. And isn't that the problem with this Prime Minister? He always promises a better tomorrow, but he never delivers today. I'll give it to him.
I said on Monday that I was actually quite pleased with the app, and I wonder whether he's pleased with the app and whether he's installed it and switched it on.
Yes, I have indeed installed the app. It's taken a significant period of time and a significant amount of wasted money to actually appear, but it finally has appeared. And I would encourage all honourable and right honourable members to download it. I'll give way.
I'd like to point out to the member for High Wycombe that the app actually works better in Wales because all the tests can be properly downloaded in Wales, unlike in England. And whilst he's at it, can he just point out that the concession that the government has so-called given to members like the honourable member for Wycombe, with whom I agree on many of these issues today, is nothing. It's not worth the paper it's not been written on. We'd like to see something in writing about what this consultation with this House will really look like.
Well, my honourable friend is absolutely right, and I think the lesson with promises from this government is you always need it in writing, and even then it isn't necessarily delivered. But I will, but then I'll make some progress.
He'll be able to read it in Hansard in the morning.
Thank you. Thank you, Mr. Speaker. Moving swiftly on. In England, the number of tests, the availability of tests, and the turnaround time simply isn't good enough. And so dire is the situation, the Prime Minister is even arguing with the Health Secretary over whether testing even matters. Now, the Health Secretary said, and I quote, "Finding where the people who test positive are is the single most important thing that we must do to stop the spread of the virus." Now, I agree with him. I agree with the Health Secretary. The shame is, though, the Prime Minister doesn't appear to, because he said the complete opposite, and I quote, "Testing and tracing has very little or nothing to do with the spread or the transmission of the disease." Yet again, Mr. Speaker, the Prime Minister refusing to take responsibility for his own actions and his own failings. Testing of care home residents and staff is critical to saving lives. Yet in England, there have been repeated delays to the rollout of testing, and people have waited days for their results. And we are witnessing, frankly, chaotic scenes at our universities as students are locked down for the want of testing. The Prime Minister has been talking about a moonshot. But it's time he stopped looking up at the sky in vain hope and focused on what is happening in the everyday lives of families and businesses up and down the country. And the failure to show that grip and strategic leadership has severely hampered the way the UK government works with other governments, as was set out by my right honourable friend. Some have not even been properly informed of lockdown plans for their own areas. And let's take yesterday, when we had the chaos of the Prime Minister himself unable to outline what additional restrictions his own government was implementing for the northeast of England. It is frankly an embarrassment, and people deserve better. Frankly, if the Prime Minister actually bothered to communicate with some of the devolved governments, he might learn something. In Wales, Mr. Speaker, the tracing system is significantly better. The percentage of contacts that's been reached has been consistently higher than in England, and the Prime Minister ought to follow that best practice. Now, let me turn to some of those most at risk in our society. The Health Secretary claimed to have thrown a protective ring around care homes in England. Well, Mr. Speaker, if that's what they call the shambles they presided over, I'd hate to see what they consider a mess to be. And again, the Prime Minister tried to shift the blame and insultingly suggested too many care homes didn't really follow the procedure. And that was when the government's own advice at the start of the pandemic said people in care homes were very unlikely to be infected. The truth is that too many care homes were left high and dry. Not enough support, insufficient PPE, and a lack of testing. And I'm afraid to say that it was some of the most vulnerable in our society who paid the price, and very sadly, who paid the ultimate price. And yet again, care workers, who should be lauded by the government, were denigrated. And that failure on care homes is particularly relevant as we discuss and debate this legislation today and its renewal. Because the Act does contain provisions that allow for the so-called easement of legal safeguards. Now, the Health Secretary said that he thinks those are still necessary. But why are they still necessary? I read very carefully the analysis the Health Secretary published, which didn't answer the question. He tried in his speech to make a positive case for it on the basis of prioritisation. But he must realise that that does not deal with the very deep concern there is about the situation in our care homes. And he must surely understand that every vulnerable person throughout this pandemic must have the standard of care they need. We also have significant concerns about the curtailment of the use of GPs to sign death certificates. Again, the Health Secretary said he wanted to continue with that provision. What assessment has been made about the use of this power? Why exactly does it need to continue? And can he also tell us what its impact has been? Mr. Speaker, ministers have no excuse of being caught unawares. They've had months to get to grips with this. We cannot afford for action to protect our care homes and other services to be as slow and chaotic as it was at the start of this pandemic. On a more positive note, I do welcome what the Health Secretary said about the easements under the Mental Health Act. They've not been used, and I do welcome his assurance that they will not now be used. But I would say to him, what about the Children and Families Act? He didn't even mention it in his speech, and the easements under that act. I assumed from the silence that it will be continuing, and he must bear in mind those with special educational needs and vulnerable children whose rights should not be rolled back as a consequence of this pandemic. Because some of the most vulnerable people have borne the brunt of this virus and this government's failings. And we've also seen across our communities that the impact has not been evenly felt. Black, Asian and minority ethnic communities have been some of the worst hit by the virus itself and the economic fallout. And disabled people and those with underlying health conditions have made up 59% of the COVID deaths to date. In spite of this, the government has not done enough work on equality impact assessments, on measures, or made the necessary evidence available so we can openly debate and vote to address these deep inequalities. And this is an all or nothing motion today that we're faced with. But let me put the government on notice that we will not tolerate any discrimination in our society as a consequence of the implementation of these measures. And that's why I say to the government today, they should not be waiting another 6 months. They should publish a monthly review on the impact of this virus on individuals and groups, together with those detailed impact assessments. And if the government continues with the easements under the Care Act as it says it will, or indeed under the Children and Families Act, then it must report regularly to this House about the impact of what it's doing. I give way to him.
I'm grateful to him for giving way. It is really disappointing, I hope he agrees with me, the way the Secretary of State has approached this matter today. Many of us who are here have sat on select committees, have scrutinised the way in which these acts have come forward and are very willing to spend more time doing that properly. That's our job as legislators. And the approach has been most unsatisfactory. So I completely support what he's saying in terms of we need it to be better. But there are recommendations in many select committee reports, and he needs to make sure that he presses the Secretary of State to take note of those.
My honourable friend is absolutely right, and she saves me, coming to another part of my speech, that there is that quality of scrutiny available across the House on a cross-party basis. And we've had no credible explanation whatsoever as to why this debate is limited to 90 minutes today. Now, Mr. Speaker, the rights that I've referred to, relevant to the easements the government is pushing forward, protect vulnerable people. Those who need care, those with mental illness and children with special educational needs all across the country. We cannot simply put their rights to one side. And when we come to the issue of rights, there is a real issue with Schedule 21 of this Act. My right honourable friend, the member for Leeds Central, put his finger on it. The power to detain potentially infectious persons. As far as I can make out, that could include virtually anybody. So far, it's been used for 141 prosecutions, each and every one found to be unlawful when it was reviewed. I can't think of any other piece of legislation in parliamentary history that you could say that in relation to. And all the Health Secretary said was the guidance had changed, he would keep it under review. With a provision like that, the Health Secretary needs to speak to the Home Secretary, to the Justice Secretary, and do so much better. A provision that only resulted in 141 unlawful prosecutions cannot possibly be right. And I say to the Health Secretary, the government has to be transparent, has to be accountable, not in 6 months' time coming back again under the Act, but come every month to tell us an answer for the use of these powers. I'll give way to
I agree with him that 141 unlawful prosecutions, 100% unlawful prosecutions is completely unacceptable. Now, in Scotland, the police haven't been using these powers under Schedule 21, so we've not had the same problem. Does he agree with me that what we need is less widely drawn powers and Schedule 21 needs to go?
She's absolutely right. She's absolutely right, because the problem comes with potentially infected persons. It's a very poorly drafted schedule, and that's why we're seeing the consequences that we are. And as I've urged the Health Secretary again to look at it. Mr. Speaker, as we tighten restrictions and we ask for higher sacrifices from people, the economic support is becoming lower. The government claims that jobs are unviable, but the reality is that the restrictions made necessary by the government's own failure on testing are what is causing the problem. And the jobs crisis is caused in number 10 and number 11 Downing Street. The support offered is inadequate. It can't be right that it's easier to retain one worker full-time than two on a part-time basis. Quite frankly, the Chancellor is offering a cocktail umbrella for the pouring rain. And what I say to the government is work with us on these benches in the national interest, create new targeted support that can replace the job retention scheme and prevent devastating mass unemployment. Keep workers safe by protecting workers' rights, boost sick pay, make workplaces safe, and give our NHS and care services the resources they need. Mr. Speaker, you made and gave a very clear direction earlier in terms of the role of Parliament. And right across Parliament, there is a desire, quite rightly, for more parliamentary scrutiny. But the fact that the motion before us is an unamendable one, I raised it when I spoke 6 months ago for precisely this reason. And I said to the Paymaster General in that debate that it should be amendable so we wouldn't have the position that we have today. When I put it to her, she simply said, "We do not wish to do that." Now, today we find ourselves with this unprecedented set of powers, 90 minutes to debate them, no credible reason whatsoever why that couldn't have been extended. This government still may not wish to face scrutiny, but it needs to accept it will make better laws for everybody if it does accept scrutiny. And I heard what he said about votes, but it was qualified because he said, when possible. The Health Secretary needs to realise that with such strong powers on the statute book, the need for accountability is even more acute than it would be in ordinary times, not less. A strong government would come to Parliament. A strong government would accept the need for votes. A weak government would run away from scrutiny and hide its own incompetence, which is precisely what the Health Secretary and the Prime Minister are doing. Mr. Speaker, the British people are making an incredible contribution to tackling this virus. Our country has huge resources, brilliant scientists, our NHS, our remarkable frontline workers. They've all been at the disposal of this government. Yet 6 months after this act was last considered in this House, we find ourselves in a perilous situation, critically undermined by the failures of this government. So I say to the government, get a grip on test and trace. There is no excuse at all, for not having a fully functioning system now. Communicate well with the public, because the mixed messaging helps nobody. Act to prevent mass unemployment now. Because the British people, Mr. Speaker, can no longer afford to pay the price for this lack of strategy and grip. Frankly, they deserve so much better.
As I say, 3-minute limit, starting with Sir Graham Brady.
Thank you, Mr. Speaker. Mr. Speaker, may I begin by thanking you. Although you gave your reasons earlier for not selecting the amendment that is in my name and that of 80 other colleagues across the House, you also made your expectations of government crystal clear. No one can doubt your commitment to upholding the standing orders of this House, Mr. Speaker, but nor have you left any doubt about your resolve in defending parliamentary democracy and the right of this House to scrutinise and hold ministers to account. I'm also pleased, though, to be able to thank my right honourable friend, the Secretary of State. Throughout my discussions with him, he has accepted the need to find a better approach to scrutiny and parliamentary approval of coronavirus measures. The new procedure that he has committed the government to following shows a genuine understanding of what has been wrong in the past and a real promise of transparency and engagement in the future. Mr. Speaker, I believe the outcome we have reached is in the interests of Parliament, in the interests of better government, and most importantly, gives the British people reassurance that measures which restrict their liberty, interfere with their family life, and very often threaten their livelihoods, will not be implemented without important questions being asked and answers given in advance, of course.
I'm grateful, and because it's not clear necessarily outside the House, will my right honourable friend agree with me that what the Secretary of State has effectively confirmed at the dispatch box, with just the one change of the word practicable to possible, is exactly what my right honourable friend put forward in his amendment, which we understand, for very good reason, the Speaker was unable to select.
I'm grateful to my right honourable friend for that, because I think it's important to say those of us on both sides of the House who put our names to that amendment were seeking to be eminently reasonable and accept the difficult constraints under which the government is operating. And I think it's important that the government accepted that in those terms. We believe it was in good faith, and we will, of course, hold the government to that.